So have a seat, Miss Hancock. My name is Dr. Coletti, but you can call me Scott. This is Dr. Donovan. Who referred you to us? Was it your primary care doctor?
No, actually I saw it on the back page of the Sun Post News.
Okay, so the newspaper. So we always
Right.
like to know who to thank, so I guess we'll thank the newspaper.
Except they had the wrong phone number.
They
so
did, in fact,
I
yeah.
watched that.
Those for us and actually having advertising out there with the wrong phone number.
Yeah.
And I'm gonna have to take
I
credit for
called
that.
information and got your
You know, it's
numbers
funny, the
and
girls
that's
made a
it.
comment that you called 411. I'm
Yeah.
like, does that number still exist?
I know, I couldn't figure out another way to do it, so that's how I did it.
Well, we're glad you're here, okay? And you're here because primarily you have both shoulder pain or between shoulder blades. Go ahead in your words, explain to me.
Both shoulders are, well, I've been told I have bursitis, tendonitis, spurring, I have everything, but I have a 92-year-old mother that I take care of, and so I have to do a lot of lifting and stuff, and I can't lift this arm more than here.
Are you right-handed?
Yes.
Okay.
And I saw this cold laser thing, that's what caught my eye. I have no idea what it is, so I thought, well, it won't hurt to come.
Sure.
Just check
And,
it out.
and that's what we're going to do today. We're going to just openly communicate a little bit. We'll do a little bit of an orthopedic and neurological exam, which is very simple. And after that, what we'll probably do is any x-rays needed, we'll send you in for x-rays. And then which I think we actually already did with you today, which is a little reverse, but
Yeah, she did x-rays.
she's just on her spot today. So, and we'll go over those x-rays, and frankly, you know, we'll take a look at it, we'll let you know, A, if we think we can help you, B, if we think you're just in the wrong place, you know, go get surgery or
Right.
whatnot. But we're gonna communicate with you very openly to make sure that you are in the right place, and B, if we can help you, we're gonna give you a game plan for that, okay?
Also, I have extremely bad lower back pain. I didn't know this was a chiropractic clinic, so.
Okay. So you got other issues besides that.
Bad, yeah.
Well, let's back up for a second here though now, because one of the things we like to do is, like let's stick with you know, my ear hurts, my elbow, my
Yeah.
jaw, my knee, because one of the things with regards to the lower back, we can certainly help you with that. Obviously, we treat quite a bit of that, but if it's your primary, like the biggest thing in your life that's creating kind of havoc in your shoulder, then maybe we should stick with that right now.
Right.
Fair?
Right.
Now, you said you're right-handed. Have you had? So it says 20 years you've been dealing with this. You didn't fall out of a tree last week.
No, I was a transcriptionist. I've typed since I came out of, I graduated high school.
Sure.
And typed fast and typed a lot. So it's,
Where are you from, Hollis?
Chicago area, Illinois.
Okay.
But I became a transcriptionist about 25 years ago. Worked at Baywest Point, and there was only 2 of us doing all of the radiology transcription
Really?
for that whole department. So you can imagine how much and how fast and how tense and for all those years.
Do I dare ask you how many words per minute? We all took that class at some point.
Oh God, probably 130, 140
Wow.
words a minute.
That's
yeah,
crazy.
we used to get, yeah. They all.
So you're done with that now. So your life
Yes,
now is
I'm
consumed with your
retired.
mother and kind of caregiving, which is very
Right.
physical, I'm imagining.
Right. Yes.
Okay. Now, on a scale of 1 to 10, you circled an 8 out of 10 with that shoulder. Is that, like
That's-
right now, not moving, is your shoulder hurting you?
Oh yeah.
So it's just
It's
chronic
constant.
ache.
Yes, it's a
And
chronic.
I'm imagining with any increased activity, more.
Then it gets worse.
Okay.
And I love to play bingo, and when I do the up and down, then I would say it probably gets to a 10. It hurts
So it's
bad.
really affecting your activities
Oh,
of daily
yeah,
living.
definitely.
So, and you're young looking. How young are you?
66.
Well, you got that going for you. You don't look 66.
Oh, thank you.
So we'll start off by basically just figuring out what we can do to help you. And let me get you to
The
have.
pain, I will tell you, radiates right in here. I have been told that there's some kind of a spurring that hits the tendon.
Right.
And this area right here is where, I mean, the pain is in the joint.
Sure.
But when I
The burning part and
when
was
I
right
move
there.
it, like it's like somebody stabbing me
Okay.
right there.
Have you ever had any MRIs of your shoulder or your neck region?
Yes, the shoulders I have.
Not your neck?
I think. I'm trying to think if I had a, yeah, I'm pretty sure I did.
Well, you said 20 years, so this is
Yeah, I'm
something you
pretty
just
sure I
dealt
did.
with,
Yeah.
basically.
Oh yeah, I just put.
When's the last time you saw a physician of any kind for this?
I went to physical therapy,
Yeah.
which only made it seem to make it
Yeah.
not quite that good. I was actually going for my back, and they threw it in my shoulder.
Through in your shoulder too. Are you taking any medication for this, or just over the counter type stuff?
Just over the counter.
Okay, and it's still a 7 or higher out of 10 on the pain scale. And you're not having or experiencing any neck pain.
The only thing I do, and this happens to me probably once a day.
Yeah.
I'll be sitting there and I get one of them spasms that shoot up.
Like a stinger?
Pain. It goes all the way up to like maybe here.
Yeah.
And the only thing I can do is go like that, and then when I put my head back
Until
down,
it relaxes.
yeah, and it's a lot of times when you yawn, that's what seems to bring it on, and it goes right up. And
So
it's
you better
always
not
this
yawn
side.
anymore.
Yeah, I know. It's always on the left side. So
Okay. So,
I always
well, we're going to take a look at that because whenever we have any extremities, whether it's a hip or a knee, we're going to look at the low back. If it's a shoulder, elbow, or wrist, we're also going to look at the neck because we know those are the nerves that actually control those
that's
regions.
what I've always contributed that to, was
Yes.
the shoulders.
But that's part of, that'll be kind of comboed in. The lower back can make you a little further away, but there's never been an episode or a traumatic experience on the shoulder, like a major fall or just a progressive transcriptioning injury.
Right.
Let me get you to have a seat right here facing that direction. And you're not afraid of heights, are you?
Well, yeah, but not as
Not
high
this
as
side,
this is
okay.
gonna go.
So hammer, or the reflex hammer over here. Okay, sitting up straight and tall, the perfect posture. Any discomfort when I kind of push, just relax when I push down on your head. Does that bother your neck or shoulder? Okay,
No.
good. At an angle, does that bother you?
Nope,
Okay, and does that bother you?
not really, no.
Okay, but a little mildly there. Now, when I raise
I
up,
felt
does this
it.
feel like a bit of relief when I do that?
No, not
Okay.
really.
Sorry, arms all the way up right there, okay? Hold them there. And then I'm gonna try, I want you to resist me, okay? Resist, but it hurts, huh? You can do it, but it hurts, correct? Now I'm gonna go up, resist. 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 Go out, good. Okay, now just in your wrists, okay? Resist. Okay, try to come down with the wrists, resist. Okay. And we're just gonna have you sit up straight and tall, close your eyes, just gonna check some reflexes, relax, loose. Good. At least we know you work neurologically. Relax. Good. Okay. I want you to take a deep breath for 2 seconds and I want you to do this. Bear down and let me know if that causes any pain in your shoulder or neck region. Just for 2-3 seconds. Okay, good. Experiencing any headaches at all?
I get a lot of headaches.
A lot of headaches. Are the headaches
Right
just
now.
throughout the day, or is it something you see
Yeah.
more at the end of the day, or is there something that brings them on?
Throughout the day, I got one right now, probably
Okay.
tension.
Relax. Okay. Just try to, and I know it hurts you, okay?
Yeah.
But try to let your entire shoulder go. All of that just hurts.
Mm-hmm.
Okay, there's quite a bit of crepitus. And Doc, can you put those x-rays up for us?
Sure.
Yeah, right there. Oh,
Right through
that-
here.
Oh, yeah.
So you're gonna learn to love to hate us, I can tell you that.
That hurts.
Where did you get your name from? I love the name, that's a very unique
Would
one.
you believe my mother saw it on a billboard?
And she told you that story too.
Yep.
I thought you were supposed to make up something in
No.
regards to. I'm just gonna lower you a little bit. Yeah, both of us like that are fine. Okay. Sorry. Any kind of that motion. See, one of the things I think you're going to help find is with our cold, not to get too far ahead of ourselves, but with the cold laser, it's acts like a WD-40. It's going to help to just open up the joints. And a lot of times, all pain comes from inflammation. So if
Right.
you're having pain, 7 out of 10, there is chronic inflammation that just won't get the heck out of there.
Yeah.
So we're going to see if we can help you with that. Now looking here, if you want to just turn your body just ever so slightly, okay? You can kind of see your shoulder. Things look from a structural standpoint very good. Why do we take x-rays on the shoulder when this is probably more of a musculoligamentous problem or inflammatory problem like I told you? Is to see what type of level of degeneration. Degeneration is simply, this is an example of the spine. That's a degenerative bone. You see how it's all worn away? That's not. So we want to see how degenerative or not is the actual shoulder joint, which is the epicenter of your pain. And this is good news because it's not
Like that.
highly degenerative, which tells us Typically with something like this, we can help to facilitate the cold laser with some passive flexibility and some electrical muscle stimulation and joint mobilization to kind of get it moving again freely and funnel out that inflammation so it's not so chronic. Now with a 7 out of 10 pain, but increase with any increased activity of the shoulder, standardly we will take a new patient with any kind of joint like this with not significant degeneration, and I'm going to put you in an 8 to 12 visit bracket. Okay, cold laser is a treatment process or protocols that is like an onion layer. We can't just shine a light on your shoulder and say everything's healed. Okay, you're only 66 years young, and if you're looking to stop this issue and decrease that inflammation and gain mobility back and increase your activities of daily living, like helping your mother at 92 years old, now is the time. Okay, this is good news, and we are going to address the neck because we know the nerves here open up or control the shoulder. Okay, so we're going to include it within our treatment therapy. Every visit will be about an hour-ish, okay? And each visit has to be subsequent, okay? So when I say 8 to 12 visits, I want you to commit yourself to at least 3 weeks of care. If you're better in 3 or 4 visits, there's the door, see you later. You follow me? This white jacket on Dr. O'Donovan or myself does not create genius status. All of our new patients and all of our joint problems or cold laser protocols are consistent with our past history. We've been dealing significantly with our cold laser for almost 4 years now, with an 85% improvement rate. So we want to get this 7 out of 10 down to your worst day, a 3 or perhaps a 4. Does that sound like something that you'd like?
Well, yeah, depending on how much it costs.
Oh, everything, it's only $1 million, so I think you'll be able to get through that. Any questions on this? The girls will come in just a moment and discuss any of your scheduling or any of your financial responsibilities, okay? You do not have to choose to site today, okay? We make all of our cold laser protocols efficient, effective, and affordable. We've never turned away a patient because they flat out couldn't pay. We'll make it affordable for you, okay? We just want a commitment from a patient because our results are pertinent to you committing to that. You follow me? And like I said earlier, we say 8 to 12. If you're feeling out of pain, down with 3-4 after 3-4 visits, see you later. We're not going to hunker you in and tie you down here.
Right.
You follow? That 8 to 12 visit though is our average. That's what we look at and say, hey, with a condition like this, the patient's age and level of pain, because you will see progressive improvement from day 1.
Great.
Okay. But any questions on what I've discussed, or do I talk too fast?
No, you're fine. But do you see the spur that they were talking about that cuts into?
Nothing of significance.
No.
So that's good news.
That part is.
Because if there was major degeneration in spurs, we'd be like, a spur is like a stone or a pebble in your shoe.
Yeah.
And it's like, gosh, if we could only take the shoe off and get rid of it. I'm very positive with what I think we can do with you, okay? And so I'm gonna have the girls come in if you don't have any questions either for myself or Dr. O'Donovan, and they'll discuss that with you. We'll go from there.
See, when I'm talking to you, that gives me a headache.
Yeah, I can already tell.
So, yeah.
But you need us like you, trust me. You are gonna, I'm so excited for you because you're gonna feel so much better.
Really?
Yes, and then you tell all your friends, and that's where 90% of our business comes from.
Yeah, sure.
Although you came from a paper.
Yeah.